Hi everyone, I am back. If you do not know me, let me introduce myself. I'm Erica Desper, pediatric sleep and potty training coach and founder of Confident Parents throughout the summer and the fall to bring you lots of great information and tips to make your day-to-day family life easier. And we are back today with a special guest who has just joined. Welcome.
Hi.
And this is Perri Shaw Borish. She is a mom, first of all. Most of us are, right? She's a mom to three, I forget.
Three.
Okay, mom of three. And yes, and a psychotherapist and the founder of Wholeheart Maternal Mental Health. So thank you for joining. Today we're going to be talking about how to manage anxiety, particularly anxiety surrounding COVID and a reopening world. But first, Perri, let you introduce yourself and tell everybody a little bit about who you are and what you do, and then we'll dive in.
Thank you. Thanks for having me. Can you hear me okay?
Yeah.
Yeah? Okay.
Yeah, I can hear.
So my name is Perri. Okay. I'm a mom, as Erica mentioned, and a psychotherapist. My specialty is maternal mental health, and I have a small practice where I have 6 therapists that work with me. Actually 5, I'm the 6th. And we specialize in all things related to maternal mental health. So anything that happens in the pregnancy, psychosocial, gynecological issues, anything that happens in the postpartum period, loss, grief, as well as anxiety disorders.
Awesome. And usually we're going to be touched by something, during that time period, right? So I know how much you help moms and families, and thank you for what you do. Okay, so we have some parents joining us right now. Thanks everybody for joining. We're excited to have you. If you have a question that you want Perri to address during this chat, feel free to go ahead and put it in the comments, and I'll be checking in there. So for those of us who are accustomed to anxiety on a daily basis, this pandemic and the reopening has not been easy. And for those people who are not accustomed to daily anxiety, welcome. I'm sure you're experiencing some now. I don't think very many people are getting away with not experiencing some sort of anxiety these days. So let's start with, how can we notice when anxiety surrounding this is sort of taking us over, and why is it even important to notice? I'll let you address that.
Sure. I want to actually take one step back before we start with that and say that anxiety is really normal. And especially when there's a new situation or new transition, like a pandemic, which, except for some much elder folk, none of us have experienced that.
Sure.
So, parenting in a pandemic or not parenting in a pandemic is really an appropriate time to have anxiety. And I think part of what makes the pandemic so complicated for moms in particular is that, normally our anxiety kind of ebbs and flows like this, right? And there's normal anxiety. And then there's really severe anxiety that affects your day-to-day living. In the pandemic, a lot of our anxiety was just spiking, right? And staying at this really high level. And for some people, when the vaccine came out and they got the vaccine, or if your children are old enough to get the vaccine, some of that anxiety came down. But for those of you who have young kids and can't get your children vaccinated, that anxiety is pretty normal to be pretty high still. So there's nothing
Yeah.
physiological. I want to make sure everyone knows that about having anxiety in a pandemic. Excuse me.
Thank you for normalizing that. And I think it's telling, we asked if anyone had questions for this chat and we didn't get any. And I think that just shows, maybe we're all a little hesitant to even acknowledge the anxiety or talk about it or share it. And it's easy to think that you're alone in it and everyone else is handling it really well, but that's probably not the case.
Yeah, moms especially. There's this feeling of being really overwhelmed right now. Excuse me. And it may just be that they don't have time to send in questions.
Right, there's that too.
or to think about, think ahead, right? This might be low priority in terms of what questions to send. And, I think moms in general during the pandemic have been asked to really go above and beyond. Most of us, had to do some kind of homeschooling, right? Or virtual, like making sure at least that our kids were logging on if they were old enough, right?
Right.
And juggling the newness of that. And some children have a lot of anxiety. And then if you're a working mom, right, juggling how to work in the pandemic while having children at home, it's pretty overwhelming.
It's a lot to juggle, for sure, which leads to anxiety for a lot of us, right? It's the juggle, it's the uncertainty, it's the newness, it's all of that, rolled into one, right? Yeah, well, thank you for normalizing it. And thanks to everybody that's here. If you have questions about managing anxiety, feel free to place them in the comments and we'll get to them. So now that we backed up, let's get back to that question of can you be feeling anxious and not really be noticing what's going on? How do we notice it? Why do we need to notice it before we can address it?
Yeah, that's a great question. A lot of people are really skilled at not noticing or not paying attention or not being connected, I should say, to their bodies, right? And there might be some really, really good reasons for that. But part of the work around anxiety is trying to connect to your body so that you can differentiate what's anxiety that you have to pay attention to versus anxiety that you sort of have to push through. Mm-hmm. Right? So one exercise I do with patients who, if they can't sort of articulate what the anxiety is, or it just feels sort of like an amorphous blob of not knowing, right, is that I'll have them try to identify where in their body they're feeling it. And then breathe into that space in the body to see what information they can get about, the feeling state, right? Or about the anxiety. Am I answering your question?
Yeah, for sure. I think I'm one of those people that's not good at noticing. And of course, I've realized that if I don't notice, I can be feeling anxious about something, but not paying attention to that. And it's causing me to be whatever, irritable or rushed or distracted. But I really have to figure out that like, oh, I'm doing that or feeling that because I'm anxious about, such and such before I can do anything about it. Right. So yeah, you're right. Some of us are good at not noticing, and definitely I'm somebody that feels it in my body. So I'll be like, why is my neck so bad today? And it's, the 30 things that I'm worried about, but trying not to think about or deal with. And I think our bodies are probably not in great shape right now. I know that mine isn't. So yeah, that did answer the question. So let's say that I'm a mom and I'm overwhelmed and I'm juggling and I have an unvaccinated kiddo, which is me and maybe some of you, and I notice that my anxiety is starting to take over. My breathing is short. I'm snapping at everybody. What is, what's the first thing that you would suggest a mom do? I know you just listed one thing. Do you want to expound on that? Do you want to add additional tips to that?
Yeah, sure. I mean, I think the first step is actually what you're saying, which is acknowledging that there's something going on, right? That you're feeling something in your body. And so for some people, it might be like you're saying, pain in your neck, or it might be your heart's racing, or your palms are sweaty, or your breathing, your breathing is shortened or quickened. And I think the first step is really trying to get in tune with that and know that, okay, even if your mind is not completely connected to your body, right? Or your brain is not completely connected to your body, you can notice first where on your body you're feeling it, breathe into that place. It's hard to make really good decisions when you're in a state of hyper arousal or really, right? So, once you're able to identify that, something's going on, I'm feeling really anxious and I'm not in danger, right? I'm actually in my house. And we can talk about difference. But one of the things that I really like to do is to have people just breathe. Just take some really big, deep inhales and exhales. Because we have to get back to sort of a baseline of being able to access your rational brain. And if you're really anxious, you can't do that.
And I think it's easy to poop. I was going to say, I think it's easy to poo-poo the breathing. Like, oh, breathing, I've heard about that. I get it. But really, when you look at the research, to confirm what you're saying, it like, we've got to get out of that fight, flight, or freeze as if we're being chased by a tiger at that moment and get back to like, the other part of the brain. And we talk about this a lot with kids that are feeling dysregulated. If your child's having a tantrum, they can't be logical or make a good choice in that moment. But it applies to us as adults too. It just looks and feels different from what we see our kids doing, but we've got to get out of that state in that moment. Yeah, sorry, go ahead.
And sometimes not. Sometimes it looks exactly like our kids, right?
Yes.
Depending on, the adult maturity level. But, if you're adding sleep deprivation, right? Or you've just given birth, or, you've just had a baby, right? I mean, there's all kinds of components that could be contributing to the anxiety.
Sure.
And we need to use the breath to calm the parasympathetic nerve so that we can actually access the resources that we have, right? So that we could say, okay, I'm not in danger. Like the tiger is not running after me, right? Because often it feels, you can't differentiate the feeling between actually being in danger and not sometimes, right? Like a panic.
Do you have a favorite breathing technique? So for those of us that aren't good at just forcing ourselves to take a few deep breaths, do you have like something to do with your hands? Or I know there's a lot of tricks out there that are helpful.
Yeah, I really like the 4-part breath, the square breath. Are you familiar with that?
Yes,
I like that.
But describe it for anybody who isn't.
Yeah, I like it because you have to use your mind. So you're focused. Both your body and your mind are focused on the breathing. So what it is picturing a square. So breathe, you inhale and hold the breath for 4. I don't know, can you see my finger? You inhale and hold the breath for 4 counts. And then you hold the breath, right, is the top of the square. And then you for 4, and then you exhale for 4. Inhale for 4. Hold for 4, and you just repeat. So you're imagining a square in your head while you're doing the breathing.
Right, like you don't have to do it with your finger and look on to those around you, right? You're demonstrating that, but you can picture it in your head. Yeah. Yes, I've seen the square breathing a lot, or triangle breathing, which is a similar concept. And I've heard of a star shape as well. I don't know if it matters which shape you pick, but the point is to take the breath, hold the breath, and correct me if I'm wrong, but I believe if your exhale is longer than your inhale, that's going to do really the most work of bringing down, what we were talking about, switching you from one state to another.
Yeah, absolutely. The exhale is probably more important even than the inhale, or as important. I mean, they actually call the square breath, they call it the combat breath, and they teach that in the military actually, to help the soldiers, I guess they're called, to help them to decide to calm their anxiety so that they can make really good decisions in the moment.
In a really stressful scenario too.
Yeah.
Okay, great. So we've got noticing, we got normalizing it, acknowledging and noticing it. We've got breathing so that we can try to get to a more rational place. So let's say I've done that. I've breathed. I know I'm not in danger in this moment, but I'm still feeling super overwhelmed and anxious. What would come after taking those breaths?
It sort of depends on what the anxiety is about, right? But if we're talking about COVID anxiety, I think, it's here to stay for a little while. And one of the things that we tend to do with anxiety is try to avoid it or push it away or push it down, right? And with something like a COVID anxiety, or if you have just generalized anxiety at baseline, it's important to make friends with the anxiety, right? Not avoid it. Let it be here. And the work is really about not attaching emotionally to the anxiety, right? So, again, with COVID, it's hard because there's a lot of not knowings, but there's a lot more that we do know now than we did in the beginning. So when the COVID anxiety comes up, another technique is to acknowledge that it's there, right? And not push it away, but sort of invite it in and label it. Okay. Hey, old friend, COVID anxiety, there you are again, right? Come on in. I'm not going to emotionally attach to you, right? And the way to do that, again, is to go back to your breath, right? So taking some deep inhales and exhales, right? You're not pushing away the anxiety because that can make the anxiety even greater. You're just acknowledging that it's there.
And with kids, we call this name it to tame it, right? If kids have a worry, we'll say, like, picture it in your mind. What does it look like? Turn it into a character and name it and talk back to it. And so you're suggesting a similar concept for adults. I know sometimes it helps me to say, like, thank you for looking out for me. I'm actually okay in this moment. Thanks for doing your job, but I'm good, and here's why. So that's a really great tip. It is our tendency to push it down or pull ourselves away from it, but you're suggesting the opposite.
Yeah. I call it like the uninvited guest, right? And there's a lot of uninvited guests, right? Not just anxiety, but the inner critic. I think of it as like someone who might just pop over for, who's not invited and pop over for coffee and
a drop in.
Really want them there.
Yeah. Right, exactly.
But you let them in, you offer them tea, and go back to the guests that you were actually invited.
Okay, great. Yeah, for sure. So we're breathing, we're noticing, we're keeping it close, talking back to it a little bit. And these would be ways to sort of lessen the anxiety that we're feeling. Let's say we can't make it feel any less? We talked about noticing and listening. What are some more like ways to manage it, aside from breathing, when it's still, really present?
Mm. There's a bunch of cognitive ways to manage it. Like, if you're doing the sort of like worst case scenario, if that's the anxiety that's showing up, you can ask yourself, what's the best thing that can happen, right?
Mm-hmm.
Think about, so like, let's say, the anxiety is like, what if my kid goes to school and gets COVID,
Mm-hmm.
right? If that you're sort of
Sure.
ruminating on. You could say, what if my kid goes to school and doesn't get COVID? What's the best? That's the best thing that could happen, right? My kid's in school, right? I don't have to worry about them. I occupy them all day. I don't have to homeschool them. They're having fun. They're social, right? They get to be a little bit more normal. Like these are the best case scenarios, right? These are the best that happen.
So try to balance your worst case scenario with the best.
Yes, and acknowledging that that's a possibility, right? Mm-hmm. That the best case is a possibility.
Mm-hmm. For sure.
And there's a lot of techniques like, just writing down your anxiety, journaling it, saying it out loud to somebody else. I mean, obviously therapy, I'm a huge proponent of that. It really works with managing anxiety and learning more about what your own triggers are and how to check in with yourself and how to take care of yourself around the anxiety. If the anxiety is really high and someone's having a really hard time managing it and it's affecting their day, it's not anxiety that's sort of like based in reality, right? I do something called a worry period where I encourage to, metaphorically have a worry box like you would a kid, and set a timer, and they can, worry. They can write it out. They can say it out loud to themselves. But they get no more than 15 minutes twice a day of a worry period. They get to say all of their worries, and when the alarm goes off at the end of the 15 minutes, they have to metaphorically shut the worry box, and leave the worries in the box. And then they're able to, right. And then they're able to revisit the worries at the second worry period if they need a second one later that day, though never right before bedtime.
Excellent. I like that. Yeah, I do use that technique with kids, but again, the feelings are similar, so we can use these strategies at any age. All right, great tips so far. Anything else that you think is super helpful for managing this anxiety or just general that we haven't touched on yet?
Yeah, I mean, I think times like this, you have to sort of go back to basics too, right? So and this can be really hard for moms, but sleep is super important in terms of managing anxiety. Getting consistent, regular sleep, right? Doing some kind of stress relievers, like some kind of movement. It doesn't mean you have to exercise. To break the stress cycle can be really useful. Eat well, avoiding drugs, alcohol, doing some really basic self-care, finding moments of self-care where you're just really nurturing yourself and self about like what do I need right now? What would fill me up? What would make me feel cared for, and giving yourself whatever that is, right?
Yeah. And I feel like self-care, some of us kind of tune it out because we've heard so much about it, but it's just, you can't really work on something big like anxiety if the self-care is not in place, and call it something else if you want to call it something else if you don't like that buzzword, but the concept and the need for it would stay the same. It just kind of has to be there, and I'm easier said than done. I'm working on that myself. Okay, and then I didn't ask you this in advance, but I think it's a good thing to ask. How do we know if this is beyond us? How would a mom know that, like, okay, all these tips and tricks are not all that I need, and I should reach out to someone for help, a professional?
I think if it's affecting your day-to-day life, if you're self-medicating in some way by, drinking or smoking cigarettes or using, drugs to medicate, if you're unable to sleep, if you have, and with new moms, if you're not able to sleep when the baby sleeps, if you have ruminating thoughts, like thoughts that just go on repeat and you can't redirect yourself or get out of them. If you have worries that are really disturbing to you, right? Or thoughts or scary thoughts that are disturbing to you, thoughts that maybe you're even ashamed to say out loud. If you're, really, there's such a wide range of things to come to therapy for, but if you're not leaving your house, for example, or allowing your kid to leave your house, in certain circumstances, of course, if you're immunocompromised, right, or somebody that you love is, right, there might be a reason for that, but I think also asking the feedback of people around you who know you and care about you, when you reach out to your support network and say, hey, this is going on, what do you think? And really listening to their reaction.
Because if we're not managing well and functioning well, those people are going to be seeing that.
Yeah, for sure.
And what does therapy look like in this current, is scary? Or like how is that working?
Sorry, you broke up. Do you mean virtual or in person? Is that what you were asking?
Yeah, right.
A lot of therapists are still just virtual. I'm doing as many in-person sessions as possible, but it's sort of a mix.
Mm-hmm. Right. So if you need the support, but you're not comfortable with in-person, virtual is still an option, which is good to know.
Yeah, and it's so great for new moms. Because
for sure, who even under normal circumstances, who can or wants to get baby all organized to leave the house, right, or get themselves to leave the house.
Yeah.
Awesome. So obviously there's a lot of resources. If a mom is watching and feels like she isn't functioning or managing as well as she wants to, and she wants to reach out, do you want to tell everyone where they can find you, or list any other immediate resources if they're feeling, at a point where they have to make a call right away?
Sure. We're Wholeheart Maternal Mental Health .com. You can find us online. It's really hard to find a therapist right now because everybody is in therapy and there's a really big need. Sure. But there are a bunch of places in the city that do take insurance, and some places that offer sliding scale. And we sort of have a policy at Wholeheart, which is pretty unique in that if someone calls and we can't help them for whatever reason, we'll help them find somebody who can, because that's really important to us. There's also there's some great free support groups on Postpartum Support International. And it may not be specifically about COVID anxiety, but it's a great way to connect with other moms. And the Motherhood Center in New York has some good online groups as well. Yeah, you could always just email me at Perri at Wholeheart Psych, Psych, if people need help finding resources.
Okay, great. All right. Well, hopefully that was helpful for everyone. It is a really timely topic, and I hope some moms who were watching can take some breaths today and know that they're not alone and we're all in this together. And they can come find you at Wholeheart Maternal Mental Health, and you're at Wholeheart Psychotherapy on Instagram. Anything else, any parting words you want to leave us parents with as we go back into this reopening world?
I guess I would say just that you're not alone, and there's amazing therapists who want to help, who are trained for this, but also this is really normal, and it's not, there's no shame in it, and there's no shame in getting help.
Yeah, for sure. I hope to have you back one day when we can just talk about general anxiety and celebrate that we've all gotten past this pandemic. So there's a lot of thank yous in the chat. Everybody's finding it very helpful, very practical. And I'm glad that so many were able to join. And of course, this will be available on replay for anybody who couldn't join. It's hard to find a time when, lots of parents are free. So thank you so much for making the time today and sharing your expertise and your insights. And we'd love to have you back again.
Okay, thank you so much. Thanks for inviting me.
You're welcome. No problem. Everybody enjoy the rest of your day, and we will be back soon with more awesome resources. Thanks.
Okay.
Bye-bye.
Bye.